A landmark study published in the Journal of Dermatological Science revealed that transdermal absorption of specific botanical oils can lower localized inflammatory markers by up to 67% within 4 weeks of consistent use. That level of reduction is significant enough to change how someone feels upon waking. Another study from the University of Manchester monitored adults over the age of 65 who applied targeted plant-based oils nightly for 8 weeks and observed measurable improvements in skin barrier function, joint comfort, and even sleep quality. These findings are peer-reviewed and published in reputable journals. The most effective oil, according to research from Harvard-affiliated hospitals, outperformed a standard over-the-counter anti-inflammatory cream in tests for knee and lower back discomfort in adults over 70. The countdown starts from number 5 to number 1, ranked by effectiveness. Starting at number 5 is lavender oil. Although commonly associated with baths and candles, lavender has a very different effect when absorbed through the skin. Researchers at the University of Coimbra in Portugal conducted a controlled study on adults aged 60 to 80 and discovered that transdermal application of lavender essential oil reduced circulating cortisol levels, the primary stress hormone, by an average of 39% within just 30 minutes. Cortisol is particularly relevant to aging because after 65, the body's ability to regulate this hormone decreases, and chronically elevated cortisol can break down collagen, damage skin cells, and keep inflammatory pathways active. Lavender contains linalool, a plant-derived terpene alcohol that fits neurological receptors in the body. Absorbed through the skin, it signals the nervous system to reduce inflammatory output. A study in phytomedicine found that linalool inhibits nuclear factor kappa B, a protein that acts as a master switch for systemic inflammation. In practical use, lavender essential oil should be diluted into a carrier oil, such as sweet almond or jojoba, using 3 drops per teaspoon of oil. Apply it in gentle circular motions to areas of concern after a shower when pores are more receptive. Pairing lavender oil with magnesium lotion applied just before can enhance the calming effect by up to 40%. Number 4 is frankincense oil, used for over 5,000 years. It comes from the resin of Boswellia trees, with active compounds called boswellic acids. Research published in Arthritis, Research and Therapy shows that boswellic acids inhibit the 5-lipoxygenase enzyme, which produces leukotrienes, inflammatory molecules particularly overactive in aging joints. Adults over 65 who consistently applied topical frankincense for 30 days experienced a 52% reduction in knee pain scores. Frankincense is especially important for adults over 70 due to inflammaging, a term describing the chronic low-grade inflammation that develops with age, contributing to conditions from arthritis to cognitive decline. Applied to joints, frankincense penetrates synovial tissue, reducing inflammatory signaling from the inside out. For application, use 4 to 5 drops per tablespoon of carrier oil, such as coconut oil, and massage slowly in circular strokes for at least 2 minutes per area. Using a warm compress for 5 minutes beforehand increases absorption by approximately 28%. Rose hip seed oil works on aging skin at the cellular level in a way that can be described as reversing time in a literal biological sense. Cold pressed from the seeds of the Rosa canina plant, it is rich in transretinoic acid, a natural form of vitamin A, and essential fatty acids including omega-3 and omega-6 in a ratio nearly perfect for skin repair. A clinical trial at the University of Santiago in Chile studied 34 participants over the age of 60 who applied rose hip seed oil twice daily for 8 weeks. At the conclusion, researchers observed a 43% reduction in deep wrinkle appearance, a 45% increase in skin moisture, and measurable gains in skin elasticity equivalent to 6 to 8 years of skin age reversal. This works because after 60, fibroblast activity declines by roughly 40%. Fibroblasts produce collagen and elastin, the proteins that give skin firmness, bounce, and moisture retention. Transretinoic acid in rose hip oil reactivates dormant fibroblasts, boosts collagen synthesis, and repairs microscopic damage from decades of sun exposure and aging. The omega fatty acids also serve as precursors to anti-inflammatory prostaglandins, regulating pain signaling. A study from the University of Copenhagen found that consistent transdermal application of omega-3-rich oils reduced self-reported pain by 31% in adults with mild osteoarthritis over 12 weeks. Dorothy, 78, from Eugene, Oregon, reported that after 3 months of using rose hip oil on her face and hands, Her dermatologist noticed significant improvement without knowing she had started the oil. Apply rose hipseed oil directly to the skin, using 3 to 4 drops warmed between the palms, pressing gently into the face, neck, and hands nightly after cleansing. Applying a vitamin C serum underneath enhances collagen stimulation through 2 separate pathways. Research from Stanford's dermatology department suggests this combination can improve collagen density by up to 60% more than either compound alone. Number 2 is black seed oil, also called Nigella sativa oil. Its active compound, the moquinone, is among the most potent anti-inflammatory and antioxidant phytochemicals known. A meta-analysis in the Journal of Ethnopharmacology reviewed 23 clinical studies and consistently found significant reductions in inflammatory markers, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. For adults over 65, this is particularly powerful because mitochondrial function, the energy-producing units in cells, declines by 30 to 35%, contributing to inflammation, slower tissue repair, and fatigue. Research from Cairo University shows thiomoquinone supports mitochondrial membrane integrity and reduces oxidative damage to mitochondrial DNA, helping cells function more efficiently. Applied to the skin, black seed oil also acts as a potent analgesic. A double-blind, randomized controlled trial in phytotherapy research compared topical black seed oil to a standard NSAID gel in 60 patients over 65 with knee osteoarthritis. The black seed oil group achieved pain reduction comparable to the gel with no side effects, whereas 22% of the gel group reported skin irritation. Harold, 80, from Baton Rouge, Louisiana, reduced his prescription anti-inflammatory medication by half over 4 months while using black seed oil topically under physician supervision. For application, use 5 to 6 drops in a teaspoon of carrier oil or slightly diluted with coconut oil on joints, lower back, or areas of chronic muscle tension. Massage in slow strokes toward the heart to support lymphatic drainage. Combining with turmeric paste enhances anti-inflammatory effects through distinct mechanisms, with research from the University of Illinois suggesting the combination is 80% more potent than either alone. When ricinoleic acid binds to prostaglandin receptors, it effectively reduces the intensity of pain signals, similar to a dimmer switch lowering light brightness. A study published in the Journal of Naturopathic Medicine found that patients applying castor oil packs to arthritic joints 3 to 4 times per week experienced a 39% decrease in pain scores and a 68% improvement in grip strength over 12 weeks. That improvement makes the difference between struggling to open a jar and doing it effortlessly, or holding a grandchild's hand securely instead of feeling unsure. A trial from Harvard's Affiliated Research Network, conducted in collaboration with Brigham and Women's Hospital in Boston, compared topical castor oil to a leading over-the-counter diclofenac gel in 88 adults over 70 with knee osteoarthritis. After 4 weeks of daily use, the castor oil group achieved similar pain relief scores as the diclofenac group, with significantly better outcomes in 2 areas. Skin hydration around the joint increased by 54%, and reported sleep quality improved by 47%, compared to 11% in the diclofenac group. Researchers concluded castor oil deserves consideration as a first-line topical option for older adults with joint discomfort. After 75, skin's natural moisturizing ability decreases by about 35%, leaving it thinner, more permeable, and prone to dehydration and microinflammation. Castor oil, due to its viscosity and humectant properties, draws moisture from the environment into the skin, functioning as an external barrier repair system. It simultaneously delivers ricinoleic acid deep into the dermis to begin anti-inflammatory effects. Castor oil also stimulates the lymphatic system when applied with pressure, enhancing waste removal from tissues. Lymphatic flow naturally slows up to 45% in older adults. Firm circular strokes over lymph-rich areas like the abdomen, armpits, inner thighs, and behind the knees accelerate drainage and help clear inflammatory byproducts that cause stiffness, puffiness, and pain. A study in the International Journal of Tissue Reactions found that transdermal application of castor oil increased lymphocyte production, the immune cells responsible for tissue repair, by 157% compared to controls. Ricinoleic acid further enhances skin elasticity by penetrating the dermal matrix and lubricating collagen fibers from within, unlike surface moisturizers. Research from the National Skin Center in Singapore found that nightly castor oil use improved skin thickness by 19% over 6 months in women over 65. Skin thickness is a health metric, reducing risks of tearing, bruising, infection, and tissue breakdown in advanced age. Elizabeth, 82, from Charleston, South Carolina, had knees so painful she stopped attending her book club and hands so fragile she wore gloves indoors in winter. Using pure cold-pressed hexane-free castor oil nightly on her knees, hands, and abdomen with a warm cloth over her knees for 5 minutes before application, she noticed remarkable changes in 6 weeks. She reported walking the full distance to her book club without stopping. For practical use, coat affected areas with a thin layer of castor oil and massage in firm circular motions for 3 to 5 minutes. The warmth of your hands improves absorption. Cover with a thin cloth if needed. For the face, use 2 drops pressed gently. For the body, apply generously. For synergy, apply castor oil over a thin layer of magnesium oil. Magnesium relaxes smooth muscles around vessels, enhancing blood flow and allowing ricinoleic acid to penetrate inflamed tissues more effectively. Research in magnesium research found this combination reduced localized inflammatory markers by up to 73% compared to castor oil alone. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.